So this is Dr. Famuyiwa with Montgomery Fertility Center. So we're concluding our IVF series, and the question a lot of people ask is, what is the process of IVF or in vitro fertilization at Montgomery Fertility Center? Well, before we get to the process of in vitro fertilization or IVF, you would have had an initial consultation. So when you reach out to us, we'll ask you to send some paperwork back to us, and then we schedule you for a consultation. During this consultation, we'll get a detailed history. If you have any prior records from anywhere, it would be very nice if you could have those records available so we can review them. And then you are brought in for a physical. We'll do a complete physical. We'll look at your ovaries. We'll do a pelvic ultrasound. We want to see how many antral follicles you have. There should be some sort of activity within your ovaries. So we'll let you know how many you have that we see. Um, and then we probably will ask you to do some preliminary tests. Some of these tests have to be done at certain times of your menstrual cycle. So pay attention to what we ask you to do. Get that done as soon as you can. At that time, your partner may be asked to complete a semen analysis as well, and he may be asked to also complete some additional tests. Now, once all your preliminary tests has been done, you've been seen, we've talked, you've had a pelvic ultrasound, the next big consultation, the next big powwow is for us to sort of put all these data together. Data doesn't help us if we don't put it together. It is at this big follow-up that we now decide to treat or not to treat. And we'll explain in detail why we want to treat or why we choose not to treat. And we're going to make sure you understand. Once we've decided to move forward, we would probably proceed with checking with your insurance company to see if they need authorization for your treatment, and we'll submit paperwork for that. If we have difficulty, we may enlist your help. Believe it or not, you can actually call your own insurance company and they listen more to you. Once it's been approved, an IVF calendar will be prepared for you. We'll give you time to review the calendar. We'll bring you in to go over it with you. And at that time, we'll teach you how to use the medications that you will need. So it's going to be more hands-on each step of the way. Once you get started, sometimes you are shown how to use the medication, and it's quite understandable. You go home and you may forget. If that happens, on our website, under in vitro fertilization, at the very bottom of that page, are videos for every single medication that you will ever need. So if you forget, please don't panic. Of course, you can call us and come back in. We'll show you again. But if you just want a quick rundown, if you want to remember what to do, look at those videos. They're there to provide information for you. When we get started, the monitoring process may take 10 to 12 days, and you'll be seen every other day or as needed, 2, 3 days, whatever is needed. When we decide that your follicles are large enough and you are triggered, meaning the trigger shot is, you're told to take the trigger shot, you will be brought in where we will collect your eggs under anesthesia. Anesthesia, sort of like sedation dentistry, so you're not intubated, you have to breathe on your own, is provided by our anesthesiologist or our CRNAs. So the collection process is usually very short, maybe 5 to 10 minutes. During this time, the eggs are collected, they're given over to a lab director who will now take over from there. She will fertilize them, culture them, watch over them till they get to a blastocyst stage. Now, after your egg retrieval, of course, you are recovered. We make sure you're doing well before we let you go home. And we're going to bring you back in a few days after that to make sure that you're okay. Make sure that there are no complications, no problems, no fevers, and also to see how you are feeling. In the meantime, we will be keeping you posted on the events going on in the lab with your embryos. So I hope this answers some questions for you. Again, this is Dr. Famuyiwa with Montgomery Fertility Center. Thank you very much.